So we use a lot of implants in plastic surgery, whether for reconstruction or cosmetic reasons like for an augmentation. So today I'll show you a little bit about implants and explain some of the differences in the vast array of implants that we have available on the market today. So here we have two obviously different sized implants. The big difference in these is the diameter. The size of the diameter is very important to match your chest size so that it fills out the volume that you're looking for. The other important thing is the projection of the implants, so how far they sit up off of the chest wall. Different circumstances require different amounts of projection, and when I see you in the office, we'll go over all the different sizes of implants to determine what is the right size for you. So here we have three implants that all three have the same base diameter and the same projection, and they have the same volume. What's different with these is they have different levels of cohesivity of the silicone gel. As you can see here, that changes the texture of the implants and how they sit in your chest. This implant here has the lowest cohesiveness of the gel. It settles a little bit more, holds volume in the lower portion of the breast a little bit easier. This middle option is most commonly used for cosmetic augmentations, has a moderate amount of cohesivity, still holds a lot of its own volume in the upper portion of the breast and the implant, but still remains quite soft and natural feeling. This implant on the side has the greatest amount of cohesivity. It holds quite a bit of its own volume up in the upper portion of the breast, but the trade-off is it feels a little bit firmer when it's in the breast. It also limits the amount of rippling that happens on the edges of the implant. This is a great implant for reconstruction where you're trying to replace an entire breast and don't have a lot of breast tissue to cover some of this rippling that happens on the edges of the breast. So here we have the least cohesive implant, and we'll see what happens when we cut it open. So even in this implant that has the least cohesiveness, this newest technology of gel that we use doesn't go anywhere. Even when you stretch it, the gel goes right back into the implant. So here we have the middle cohesive implant, and we'll see what happens with it. So this gel, even when you cut it, it doesn't do anything. And as we squeeze, it bulges a little bit, but doesn't go anywhere. Now, for the most cohesive implant. You can see with this implant, even with a wedge taken out of it, all of the gel stays inside of the implant and doesn't go anywhere. This is why we call these commonly the Gummy Bear implants. So here you have all three implants. The least cohesive, medium cohesive, and the most cohesive. So that's a brief introduction to the implants we use here at Associates in Plastic Surgery. If you have any more questions about implants used for reconstruction or interested in learning more about an augmentation or a breast lift, feel free to get in touch with the office.